So the next thing we will look at is type of epiphysis. Something is sitting on top, epiphysis. Okay. So what is this epiphysis and what are its types with examples? They're asking for 5 marks. So let's get started. This is a recently asked question in the anatomy theory paper of MBBS first year. Okay. So first of all, epiphysis is what? It's the end of the bone, tip of the bone. Okay. So these ossify from secondary centers. So you can see at the end of a femur, you are seeing an epiphysis here. At the bottom also, you will see an epiphysis. Okay. So not just on the top, bottom also at the end of the bone. So if you're seeing a bone here, where and all are the epiphysis? Okay. So the epiphysis is here on top, right? And then here also you have an epiphysis. So what do you have in the middle? You have the diaphysis. So here you have the epiphysis, diaphysis, epiphysis. Between the diaphysis and epiphysis, what you have is the metaphysis. Okay. This metaphysis is there between this epiphysis and diaphysis. Okay. So these are the parts of the long bone you can remember. And basically the joint which is there between the, go back here. Here, between the epiphysis and the diaphysis, the joint that you have is a primary cartilaginous joint. Okay. This is also called as epiphyseal plate, growth plate. Very important to remember. At around 18 years of age, this epiphysis and the diaphysis will fuse, ending the growth. Okay. In height of the person, something like that you can remember. So that is epiphysis. Now, what have they asked in the exam? Types of epiphysis. So, the end of a bone, you remember, is epiphysis. That much if you remember, you'll be able to understand this topic. You have pressure epiphysis, traction epiphysis, atavistic epiphysis, and aberrant epiphysis. So, you need to remember these 4 words. Okay, what are the 4 words you have to remember for types of epiphysis? Pressure epiphysis, traction epiphysis, atavistic epiphysis, aberrant epiphysis. Okay. So let's look at examples and understand all of this now. Considering that it has been asked for 5 marks, you can even try to draw a diagram of a epiphysis. Okay. It is not that difficult, guys. You can draw, right? Let's try to draw one epiphysis. Very easy. See, here is going to be our femur head, and this is going to be our femur. And we'll say this is epiphysis, and then here in diaphysis we will show. In the middle you can draw one cartilaginous joint and say this is the epiphyseal joint. Okay. Let's just go back to that diagram. Yeah. Okay, just draw one ball type, and between that, at the end of that base of that ball itself, you write off this blue line. Okay, not in between somewhere. So this is epiphysis. Okay, so now let's go back to the topic that we came here for, the types of epiphysis. Okay, so pressure epiphysis. So look at the diagram here. You will be able to understand very, very well the explanation. So the head of femur, what they're saying is example of pressure epiphysis. Remember, they've asked example also. You have to define it also. So it takes place in the transmission of weight. So who is taking all your body weight? Your femur, the head of femur. Pressure epiphysis is articular. It will be forming a joint, right? It will be joined with the hip bone. So it is articular. It takes place in the transmission of, takes part in the transmission of weight. Okay. Example is head of femur, lower end of radius, etc. Okay. That is pressure epiphysis done. So this one is done, pressure epiphysis. Now let us go to traction epiphysis. Traction epiphysis means some pull should be there. What should be there? Pull should be there. Not pressure on it. It should be more like a pull on it. Okay. So it is non-articular. They're saying, what is it? It is non-articular. It is not there in a joint, and it does not take place in, it does not take part in transmission of weight. Whose job is that? Weight and all? Pressure epiphysis. Traction epiphysis is non-articular. It will not take part in transmission of weight. And it will, it has a pull. So it will provide attachment to one or more tendons, which exerts a traction on the epiphysis. So this is what? Attachment it will provide to the tendon. Okay. So you can see here, example. Here, this is a muscle pull. So it's a traction epiphysis. This one also some muscle pull. If you can tell the example with the name, the trochanters of femur, the tubercles of humerus, okay, trochanthers and tubercles, all those get formed later because of the traction. So that is about traction epiphysis. So amazing. You are done with 2. Butanol, you're done with pressure and traction. Now we have to go to the third one. Which one is that? Atavistic. Okay, very good. Atavistic. What is the meaning of this word atavistic? Does it have a meaning in English? Let's see. Atavistic means ancestral, it seems, something old, Purana. Atavistic means phylogenetically an independent bone. In man, it has become fused to another bone. Okay, that is why ancestral something they said. So, atavistic epiphysis, coracoid process. This coracoid process, it has become a part of which bone? It has fused and it has become a part of which bone, guys? Coracoid process of scapula. Okay, so it has joined the scapula and it has become a part of scapula. But earlier it was a separate bone, is it? What is so ancestral? Phylogenetically independent bone, which in man has become fused to another bone. Okay, atavistic. It's a little confusing. Let's go to the last one, aberrant. What is, guys, aberrant meaning also? Shall we check? Aberrant means departing from the accepted standard. That means it doesn't follow standards. Okay, so it may not be present, it may or may not be present. Aberrant epiphysis is there in first metatarsal, they are saying. So let's look at this. So where's your metatarsal first of all? All these in green are metatarsals. Where is your first metatarsal? This one is your first metatarsal. This can have some aberrant epiphysis. So not in everybody, but this is aberrant epiphysis. So it doesn't follow the standard. It is something which is away from the standard, out of standard. It is not always present. Example is the epiphysis at the head of the first metatarsal. Did I say tarsal or carpal? Metatarsal. Okay. Some people are telling metacarpal. Okay. So anyways, we have understood the 4 types of epiphysis. Just end your answer with the clinical importance, okay, and say that epiphysis, that is the growth plate, epiphyseal plate, growth plate is very important. Any injury to it can cause problem in growth, okay. Some things like that you can give, and as you should say, you should not give steroids for long term in children because it can lead to the closure of epiphyseal plate. That's the growth plate, right? That's all you can say. Clinical importance done. 5 marks hopefully you will get. Bye bye.